Thank you so much for joining us today. I'm Michelle Morris with Consolidated Planning Group. We've got a great webinar and a lot of people joining us today. So I'm so happy that we have you here, Lynsy. Thank you
Thank
for
you for
giving this talk with us about dual eligibility and what that means and how it can help the families that we work with. I really appreciate you being here. And to all of the audience members, thank you for being here too. The more we educate the community, the stronger the community will be. And so we really appreciate the fact that you're out here becoming advocates for your loved ones and your family and friends as well. A couple of things before we get started. We cannot see you or hear you, participants. So if you would like to add a comment or ask a question, please just put that in the chat box. That's the best way for us to see your questions and present the information. Now, we did receive some questions before the webinar even started, and we're going to work to kind of incorporate that into the information that we give today. So we have received your questions and we're going to answer them. The other thing I want to let you know is that we do record all of our webinars. And then after the presentation is over, we put that recording on YouTube. So if you need to step away, or if you ever miss one of our webinars and you want to go back and watch, it is on YouTube. Now, if you've registered for the webinar, we will send you an email later today that has a link to the recording, as well as the slides that we go over. If you're already maybe on our YouTube channel watching this and you want a copy of the slides, or maybe you're on the podcast listening and you want a copy of these slides, please just email contact@cpgcares.net. Probably give us the day of the presentation and the topic, and we'll get you those slides as soon as possible. Right. So who is Consolidated Planning Group and why do we present these topics? Well, first and foremost, we are a holistic financial planning firm. We're a small independent firm located just outside of Houston in the Sugar Land area. We serve families all across the United States, though, because all of our meetings are virtual. And, we look at both the special needs planning side and the financial planning side. So we can help you with anything that any other financial planning firm can do, but we take it a step further by planning for your child's needs even after you are gone. And the reason this is so important to us is because all four financial advisors at Consolidated Planning Group are also parents to loved ones with needs. There's two sets of husband and wife. We all are parents. We've all been where you are, and we've been doing this for over 30 years. So we have over 30 years of experience in life insurance and investments, financial products, and all of that stuff. So not only do we live it and breathe it, but we are here as dedicated professionals who are experts in the special needs area and can help you. We are chartered special needs consultants, members of the Special Needs Planning Academy, and we're nationally certified Social Security advisors. So welcome. Families really come to us for things like lifetime care planning, protection planning for your family, thinking about what if something happens to you? Will your family be okay without you or your income? We talk a lot about planning for big transitions in life and ABLE accounts and how that can help. The future cost of care estimate, where we look at from the time the parents are gone to the time your loved one passes, how much is that time period of care going to cost? We look at state and federal benefits and local resources wherever you are and help you make sure that you're signed up for everything that you can be and that you have the resources that you need. And then finally, again, we're here to advocate for you and to educate you on all of these topics. We know that there's a lot of noise out there. There's a lot of advice, and there's a lot of people who just want to be helpful and give you advice. but they might not always know exactly all the rules or eligibility criteria, or even what your family in particular is going through. So we are rare in this area. There are over 263,000 financial advisors in the United States. But out of those 263,000, fewer than 200 focus on special needs planning. Not 200,000, just 200 financial firms. That's less than 0.1% of all the financial advisors out there who really get this side of your life. So we understand that, planning should start as soon as possible. That means right now. Does not matter how old or young your loved one is. You want to be developing the plan for their future as early as possible. Why? Well, because it gives you a longer runway so that you can make small incremental changes that will have a larger impact. But also it gives you the opportunity to plan in a calm environment, not when a crisis has already struck or when time is already getting short. Things are always going to be less expensive if you plan ahead and more organized. So think about what's going to happen after high school. There are a lot of great options, whether it be educational, vocational. Maybe you want to look at day and transition programs or a residential community. All of those things are great, but you do want to definitely take a look ahead of time and make sure that you find a great fit for your loved one. Sign up for the programs, tour the programs, and just see what's out there. They might have a waiting list, so just be aware. And then finally, we always want to make sure that you're very careful when you're thinking about who's going to be a successor caregiver to your loved one. A lot of people assume that a sibling is the best answer to that question, but sometimes it can create tension on either side of that relationship if you put the sibling into the role of caregiver. So just be really careful with that. It's a great way to get things done, and we hope that it works out, but it can create a lot of tension. Okay. Um, I see a question in the chat box. Karen, we'll get to that. But keep putting questions in the chat box and we'll make sure we get all of them that we can. But I just want to give Lynsy a chance to get started before we, veer too far off path. So thank you again, Lynsy, for being here.
Well, thank
How
you
are
for
you
having
today?
me, Michelle. I'm really excited to talk to everybody today.
Good.
So, are we digging right in?
Yeah, I think go right ahead. Tell us about Medicaid and Medicare dual eligibility and what that means and how's that going to help us?
Yes. So, my name is Lynsy Meier. I am a Medicare advisor. I'm licensed in the state of Texas, so I primarily focus on Texans. Um, I am here to talk to you about individuals with intellectual disabilities that have a lifetime disability and um, qualify for Medicare and Medicaid. So let's talk about on the next slide. I believe it gives us a little bit of an agenda that we'll go over today. So the first thing we're going to talk about is what it means to be dual eligible. How do you qualify? I'll talk a little bit about Medicare, Medicaid, and extra help for prescription drug coverage. We'll talk about traditional Medicare versus Medicare Advantage. We'll talk about extra benefits. We'll talk about, is Medicare Advantage right for me? So before we kind of dive in, I do want to share a little bit of information and just, kind of talk a little bit about who this webinar is kind of targeted for. So a lot of people are traditionally a parent of a loved one who is disabled. But the parent, of course, is going to, age into Medicare yourself as well at 65, and you may be working past 65. You may delay your Medicare. There's different plans available for all different kind of situations. So I just wanted to make it, kind of upfront that this plan is not your only option, and this is an opportunity just to learn more about Medicare and Medicaid going together. But there's also lots of other plan options for people aging into 65 without Medicaid, or even sometimes with Medicaid. You know, there's employer plans that continue on after retirement. There's veterans benefits. I think that was one of the questions, is if I have veterans and I have traditional and Medicaid, would I still need this? There's no right or wrong answer. It's, will this work best for your loved one? Not necessarily, is this my only option? This is definitely not a one-way street and only option. It's just one of the options that I wanted to make everybody aware of. And it does work great for some, and it may not fit all. And I'll talk about those things of what would make this advantageous, but I also am super careful to make sure that you know why this may not work for you. So I just wanted to bring that up, that there are many ways to go about Medicare. And when you're sitting down to talk about Medicare, you would hope to work with somebody who can talk to you about all the different avenues and choose what makes best sense for you and your family. So in this particular case, like I said, we're talking about dual eligible. So people who have Medicare, which is federal retirement insurance, or for people who are disabled, and you get it through work credits. So that's Medicare. Medicaid is a state-funded benefit. Usually you get it if you get SSI and you're disabled at 18, you get your Medicaid. So that is for people who have some income restrictions and qualify for a state-funded benefits for healthcare. So how do you qualify for Medicare if you are a disabled child? So it's not necessarily the same as, you know, waiting until 65. There is something called a disabled adult child. A lot of people shorten that to DAC. It's also been a term referred to as a childhood disability benefits, CBD, in the past. But I think for the most part, people are kind of universally using the term DAC now to discuss a disabled adult child. So in order to qualify for DAC status, you have to have a permanent disability documented in your health record before age 22. And then, of course, the documentation would be that it's going to continue typically for your lifetime. You have to meet the definition of disability for adults, be unmarried, age 18 or older. And unmarried is another question I think that I had seen in the questions. There are some rules that says that somebody that qualifies as a DAC is allowed to marry somebody else that qualifies as a DAC and continue to get benefits. I am not a Social Security advisor. However, they are licensed Social Security advisors over at CPG, so they would be best to talk about how those benefits could continue. I focus mostly on Medicare, so that's a little bit more my area of expertise. But there are some ways, but in a lot of times, getting married would then end benefits.
Right.
Oh,
The
sorry, go
thing
ahead,
with
Michelle.
that, if I could just also say, it's not the only place where getting married affects your benefits. That also happens with SSI and other benefits. So that's something that makes me really angry. I don't think it's fair. So if you get angry about that as well, you should contact your local representatives, congressmen, senators, and tell them that you're not happy about that.
Absolutely. So if you're wanting to know if I do get my DAC status, when would I get Medicare? So DAC status hold on, sorry, go to the next slide, Michelle.
Yeah.
Let's see here. Oh, nope, that's not the next one. That's okay. My brain is going ahead of what I'm wanting to say. So let me stay in order. I'm getting ahead of myself. I'm sorry, you guys. So there is a 24-month waiting period to get Medicare when you qualify as a disabled adult child on your parents' record. Oh, I'm so sorry. I don't know why I'm getting twisted in my words. So there's a 24-month waiting period to qualify when you get your Social Security disability income, and
There
your
you go.
Social Security disability income comes whenever your parent either retires and starts collecting their benefits, they unfortunately pass away, or they become disabled themselves and start collecting benefits. So that's the thought I was trying to get to. My apologies, you
Hmm.
guys. Now let's talk a little bit about Medicaid.
There you go.
So when you qualify for Medicare, there are several different Medicaid levels. So they talk about this in your letter of from Social Security. It will say your Medicare Savings Plan, your MSP, and it will tell you what your Medicaid level is. So QMB, Qualified Medicare Beneficiary, um, that is the highest level of Medicaid. So if you qualify as QMB plus, SLMB plus, those are the ones that are going to give you the break from having to pay that Medicare Part B premium. It would be waived. And it's also going to allow you to choose from extra plans available through Medicare that are going to help pay for healthcare costs and sometimes get you a higher level of benefits. Now, you can also be, I think that's the next slide, is SLMB and QI. So these are two other qualifying levels. You can have like a little bit higher income and qualify at these levels. Every level is going to take care of that Part B premium. So that is one really great um, perk of qualifying for some sort of Medicaid when you have Medicare as well. QI is the lowest level. It doesn't help you with any of your cost share for your medical costs, but it does still cover that Part B premium, which is, right now going up and up and up. So it's helpful.
Question, what age are we talking about? When should we be applying for these things
So
for
that's
our
where I got
children?
lost in my own speech. So I can totally understand why you would be asking that question. So when you as a parent are ready to retire, so you could take your Social Security as early as age 62. And then, of course, your benefit increases as the years go by. However, this is another place where CPG can help you choose when do you go ahead and take your Social Security, because when you take your Social Security, then your child switches over from SSI to SSDI to get a higher income themselves through SSDI. So when do you take it? When do you get it? Really depends on what your needs are as a family and when it best makes sense to start collecting Social Security based on your personal situation.
Yes, we can do an analysis for parents that shows exactly when you should turn on your benefits to get the most for the entire family. And many people think that if they wait until age 70, that's automatically how they get the most, but that's not necessarily true when you get those additional DAC or SSDI or other benefits, CDB benefits for your child. Because the benefits for your child and spousal benefits outweigh waiting at a certain point. We can tell you when that tipping point hits.
Yeah. And there's no specific age for your child, just to kind of just take that question one step further. There are, kiddos in their 20s that qualify, as well as, 40s, 50s, or even 65 themselves. So it really depends on the family circumstances. If something tragic happens and a parent passes away, that's an unforeseen reason that someone younger would get Medicare at an earlier time through the SSDI they could collect. So another program that's out there for Medicare recipients is called Extra Help. So you can have extra help and not qualify for Medicaid. So this is kind of not specific to the presentation alone, but extra help is really good to know about. So there is a little bit even higher threshold for the income range to get extra help. And this is specific to prescription drug cost. So this helps you with your plan premium if there is one. It helps you with the deductible. It waives it completely so that name brand drugs become more affordable. And it also, there's a couple different tiers of extra help. So in the best case scenario, you would have limited cost. So on brand name drugs, they increase it every year. Right now, it's around $15 for a high cost brand name drug maximum out of pocket at the pharmacy, and for a generic drug, the maximum is between $4 and $5. So much more affordable than some of these drug plans that say, for a high cost brand name drug, you pay your deductible plus, 20% of the manufacturer's cost. So it can really be very, very helpful. When you have the highest level of Medicaid applied, a lot of times that wipes out co-insurance completely, and you don't have any co-pays or co-insurances with your drugs. But those rules have changed over the last couple of years, and it's a little bit harder to get all medications for free as it was in the past. So people who have had, no prescription drug cost or some over-the-counter cost covered through getting it filled at the pharmacy are sometimes now seeing some, small co-pays where there weren't any in the past based on some different federal rules and regulation changes over these last couple of years.
So, since we're talking about prescription drugs, there's a question that just came up in the chat. Will they cover the drug will they cover the drug if it's not prescribed by a Medicaid doctor? Like if they go see a doctor who is not under Medicaid, would
Yes.
Medicaid still pay for the drugs?
Yeah. Well, Medicaid alone, I don't believe that there's a distinction. That one might be just a little bit out of my wheelhouse, but just in general, I would like to say that the pharmacy isn't really looking at which doctor fills the drug. They're more looking at, is it coming from a reputable doctor to be filled, and is it covered on the prescription plan to fill the drug? So, I mean, I think there's, a little bit of a shift that sometimes going to see a doctor where you pay out of pocket to see that one doctor, but every other doctor is in your Medicaid network. We'll talk a little bit about Star Plus and the limitations to that network here in a little bit. So if that's kind of what you're thinking and you see one doctor that's, outside of that, I wouldn't think that would affect anything, but I don't know if I could say that 100%. So the next slide talks about why consider Medicare Advantage. So this is one of the things that I learned when I started doing Medicare. One of the things I didn't share with you guys yet is that I worked for a very large statewide here in Texas special needs group home provider. So I helped families where the loved one lived in a group home, the loved one lived at home in host home, or some people are able to live in their own apartment, and then they have support staff coming in, and we provided those services. So I got to work with a lot of people within this program with special needs. And a lot of families came and would ask us questions about insurance and different things and Medicare and, all of the things that come up. And it was very clear to me that we are not necessarily trained to know how all of these programs come together. So when I started learning about Medicare, one of the reasons why I decided to do this is to share that knowledge. So now in my Medicare role, I'm able to do webinars like this and help, and then also still work with the special needs provider agencies and share information with them, and just get information out there so that people know what all the options are. Because there's a lot of cases where, people just need that little bit of extra assistance. So in this particular case, when you're looking at your traditional Medicare, that's the red, white, and blue card, along with your prescription drug coverage. So you have your red, white, and blue card, and a very popular plan in the last few years is a WellCare prescription drug plan. It's the Texas benchmark plan. It might be a national benchmark plan because it's available in all 50 states and there's no premium. So those two coming together is what you would call your traditional Medicare. So you can see any doctor, there's no network. Your Medicaid would then come in as secondary, and your prescription drug coverage would cover your medications. Medicare
So,
Advantage is another option that you can choose. So it's not, I've had people ask, well, is this my supplement? Not in those terms. It's not your supplement. It's your alternate decision to not have traditional, to go with Medicare Advantage as an alternate. So basically, the federal government isn't managing the claims anymore. They're paying an insurance company to manage those claims and take care of your needs. United Healthcare and WellCare and WellPoint and all of these Blue Cross Blue Shield and all of the different insurance companies out there. There's tons of them to choose from. Yeah. So those insurance companies each come up with a plans or several plan options in your county that not only are covering your medical needs, but they're adding in your prescription drug coverage in one card. They're adding in dental care, money for glasses, hearing aid coverage, money towards hearing aids. Those are hard to come by in a full, paid in full. There's healthy food benefits for groceries and over-the-counter benefits, transportation assistance, gym memberships, meals following hospitalization. So there's lots of things out there that can help families that need extra help with these kinds of services where traditional Medicare is not helping you pay for all of those things. So when you're looking at Medicare Advantage, that's where you have to be aware of what Medicare Advantage comes with. So there are limitations to Medicare Advantage when you choose it. So they're adding in these extra benefits. So the federal government is basically saying, we're going to pay this insurance company of your choice to manage your care. So they give them money to go ahead and take over your care. And the insurance companies use that money to put plans together that can add in those extra benefits. So sometimes I do get asked, well, how can they add those in? How do they afford that? It's the money they get from the government to take care of you instead of the, government having to do it themselves, basically managing the care and the claims. So with Medicare Advantage, it's very important to know that there are limitations to the doctor networks. So you do have to choose an in-network primary care physician. You have to use in-network doctors, specialists, imaging centers, hospital systems. Everybody has to be within the network. You have to use an in-network pharmacy, which for the most part, all of the major, drugstore pharmacies are going to be in network with all plans. And you may need a referral or a prior authorization in certain cases for medications or medical services. And then, of course, you have to live in the planned service area because the plans are county-based. So that might sound a little bit daunting, like, oh gosh, that's a lot. It can be, but I'll explain the process that I go through to make sure that we set you up for success if you decide to go with one of these kind of plans. And then I also like to, kind of share the information that if your Medicaid card is Star Plus, United Healthcare Star Plus or Superior Star Plus, I think WellPoint, they might not have one this year, but they've had one in the past, Star Plus. So if it says Star Plus, that's the kind of Medicaid that you have. It's called managed care. So with managed care Medicaid, there are some really cool resources that come with that too, that they're adding in. But these requirements over here on the left side, the in-network primary care and the, referrals and the prior authorizations, those are all requirements that are also included in the Star Plus managed care. So you're already used to it. And the cool thing about the Medicare network is many times, I can't say every time, but many times I have found that when you are looking at your Star Plus list of doctors, it's pretty limited on, which doctors, especially specialists, take that Star Plus Medicaid. So what we have found is that whenever you combine your Medicare and Medicaid together, you are able to widen the network because Medicare plans tend to pay the doctors at a higher rate than Medicaid plans do. So it kind of opens some doors. Maybe not every door, but it does open more doors than the Star Plus Medicaid card.
Fantastic to know. We have some questions in the chat. Do you want to take a break and go through those, or do you want to finish your slides first and then get the questions?
No, I'm okay if you, I mean, whatever you want to do, Michelle. I think I'm okay if we go through a couple.
Okay, yeah, it's just because there's so many. I want to get some of these answered and kind of off of the list.
Sure,
I
sure.
answered some of them, and we've talked about some of those others. Um, Friend of mine told me they've had a lot of finger pointing between Medicare and Medicaid as to who should pay for what. And it's become such a problem that they just pay out of pocket. Is this common? And who should be primary versus secondary?
So Medicare is primary to Medicaid. So if you have your traditional card, your Medicare card, and then your Medicaid card, you would give the doctor both, which I'm sure you're doing, and they are probably billing one and just failing to come back and bill the other because they have to bill them both separately. Now, these plans that I'm sharing with you, they are dual plans, meaning they combine the Medicare and Medicaid into one, and you give one card and the billing office should be able to bill the Medicare and Medicare parts all in one so that that cuts back on those frustrations. So if you're having that happen, I would push back a little bit and say, did you bill my Medicaid? Double check that your Medicaid hasn't lapsed. Because sometimes if they bill it and they get, a lapse in coverage, it's very unfortunate, but I've also seen sometimes that, Medicaid lapses and you didn't even get a letter saying that you lost it. So then you're kind of scrambling to get it back. So there's a couple of things you can do to try to fix those things. But at the end of the day, if you have both and they're active and the provider you're going to accepts and is networked with the Medicaid program too, they should be billing both on your behalf.
Fantastic. Now, you had a chart up about Medicaid. She says, I thought you got Medicaid with SSI, not Medicare. This chart says you can get Medicare extra help with SSI. Is that true? Should I go back to that page? Extra help.
So from
So,
my understanding, um, extra help is in general. Um, I don't know if I know the answer to that. I am trained that extra help is part of, whenever you get Medicare. So if you get SSI and you can get extra help with your Medicaid, that is something that I'm not familiar with, but I'll definitely be researching.
yeah, yeah. Well, here it says you'll get extra help automatically with SSI.
Right.
You
So
mean like
someone
if
who
you've had
qualifies.
SS?
Oh, I'm sorry. So someone who qualifies for Medicare, if you're getting, a lot of people get SSI, um, and SSDI. So like someone who qualifies for SSI, their Medicare comes automatically whenever they qualify. So you might get a Medicare card in the mail and go, well, I didn't even know I didn't even apply for Medicare. So Medicare will come automatically. So if your Medicare comes automatically and you have certain state benefits in place, your extra help also comes automatically too. Not necessarily without those benefits in place, though. So the state does sign you up for things, on their own whenever you have certain benefits.
And the last one that I see for right now, does anybody else's income affect the benefits if the person is an adult? After age 18, nobody else's income would impact their benefits, right?
Correct. So
So,
if you're applying if you're applying for benefits for an adult living in your home, you would only include the income that they get, not your own.
okay, perfect. And that doesn't matter. whoever the guardian is or whatever the situation. All
No,
right. I
Michelle,
think
you correct me if I'm wrong, but as far as I've ever been aware, an adult applies on their own person.
yeah, that's right. That's right. So if the person is over age 18, it's their own assets, their own income, and that's generally the rule for everything that we deal with. Okay, so I'll let you go back to your talk and pick up where we left off. And then if there's more questions, and I do see more questions coming in, so we'll get into some of those.
Okay. So where we have to be aware of traditional, where we have to be aware of the limitations to Medicare Advantage, we also have to be aware of the limitations of traditional Medicare. You know, I say all the time, I would actually, I think, prefer for the sake of myself, my family, and everyone I know that qualifies for Medicare. How nice would it be if, you know, you qualify, you've paid in all these years for yourself or your loved ones, that red, white, and blue card comes in the mail. It would be so great if that just covered you 100%. And you know, those of us who do this to explain the complications of the Medicare system wouldn't be necessary. But unfortunately, the Medicare card just doesn't work that way. So
Mhm.
things to know is that if you go in, if you have traditional Medicare and you say, okay, I don't want to get a supplemental, I don't want Medicare Advantage. If you say, I'm going to have traditional Medicare and then I'm going to have my Medicaid, a lot of people prefer that because it keeps the network open with traditional Medicare, and that's a wonderful thing. The problem sometimes lies in if Medicaid lapses. So that is unfortunately happening more and more since COVID, and we had the whole Medicaid unwinding in Texas. 1 million people lost their Medicaid. You know, I'm hoping that that falls off of my presentation soon because years have passed. The problem is I'm still seeing it be a problem with people losing Medicaid because they didn't get the renewal notice. They didn't realize that they had to apply every year, which this is a great time to stop and just say a little bit off topic, but super important. If your loved one switches to getting SSDI, that means it triggers an annual Medicaid renewal. So on SSI alone, a lot of times people get really used to not having to do any updates to the Medicaid unless they have major changes. Everything just kind of flows smoothly. You don't get any upset. But when you switch over to SSDI, unfortunately, even if your circumstances haven't really changed and you're permanently disabled and you've proven this to everybody that you just, you know, you shouldn't have even had to prove it to, but you've done that all these years, they're going to ask you to do a Medicaid app every year. And now in certain cases here in our state, they're looking at changing it to twice a year. Possibly not for everybody, but you know, it's something they're throwing around. So they're making Medicaid just a little bit more difficult to keep up with. And in my own circumstances, my brother-in-law is disabled adult child living with my in-laws. So I get to help every year with the Medicaid renewal app. And something that just happened to us this summer is we apply for benefits back in February. They don't look at it until May because his benefits are effective June 1st. My sweet in-laws go out of town for the one time a year they go out of town. And when they get back, there's a letter. It says Monday, and they're looking at this on Sunday. If you don't have this, this, and this turned into Medicaid by tomorrow, basically, you're going to be denied. So it just makes you very, very anxious and like, oh gosh, I got to get all this done. So they took themselves 4 months and they gave her, you know, 5 days, which she was out of
Mhm.
town. So she saw at the very last minute. So had she come home, long story short, if she had come home one day later, Michael just would have not gotten his benefits. So that's what they do sometimes. So, anyways, back on
So
track here, off of my
but
soapbox.
when things like that do come up, do they reinstate pretty quickly when you prove, hey, that was a mistake and here's the right stuff? Or do we need to panic? Are we just out of luck?
You know, I can't really answer that because it's different in lots of scenarios. So I have heard of people walking into the Social Security office, talking to the right person, fixing the mistake, and it's just, you know, fixes overnight. I've talked to people where they have to completely do a new application and have a waiting period. So sometimes it does. It's a really easy fix. Um, I hate to say, and you guys on here who have, gone through these sorts of government programs over the years probably have had an instance to agree that it sometimes just depends who you get in front of.
So sad because I mean, these things should be, any business runs better when everything is systemized and the same throughout and,
Yes.
repeatable.
Now,
It's
the
such a shame.
And when you're talking about Medicaid, two things that I always like to share is that if you create a Your Texas Benefits account online and submit your application through there, you're going to see the flow of the application process, kind of a little closer to real time. But if you don't choose to use the internet, which a lot of people still don't like to do that and upload, personal information into the
Mhm,
computer and things, um, fax your application in, don't mail it. So we're at the
mhm,
point now in the time of the US mailing system where, even if you've got the best postman, just go ahead and fax it in. You can go to the UPS store. Sometimes it costs a few dollars, but it's just worth having that confirmation to prove that yes, you did get things turned in on time. So with all of that said, going kind of back on track here, the
yes.
reason that I get off on my little soapbox a little bit is that say you lose Medicaid on Friday and you go into the hospital over the weekend. Um, if you have Medicare alone, there is no maximum out of pocket like we're used to with so many different insurances. And that is just, I think, a very sad reality of traditional Medicare alone is no maximum out of pocket. So if the bill is $100,000, your copay or your coinsurance is $20,000 plus your hospital inpatient stay. They charge you for that as well. Now, a lot of times, if you lose Medicaid, you can ask for it to be backdated, and then that would come back and cover. Usually, you can do about a 6 month look back. So appeal that decision if you need to, and you've got some big bills. But in some cases, if you're over resources over that $2,000 and they deny you the month of Medicaid until you get it corrected, you're kind of stuck with those bills. So, one good thing about Medicare Advantage versus traditional is if you have any fear of having, a little bit of Medicaid um, um, instability, is Medicare Advantage gives you a plan that if you lose your Medicaid, you have a maximum out of pocket. So you're not stuck in there and you've got a few months to correct your Medicaid before they kind of kick you out of the Medicare plan that includes the Medicaid. So with the Medicare Advantage, I had kind of touched on some things, the extra benefits. So it adds in your dental coverage, it adds in vision coverage, it adds in coverage for hearing aids, and eyeglasses or contacts. It gives you a healthy food allowance. So it's not going to cover, the sugary snacks that we all love and sodas and things like that, but it is covering healthy foods. And a lot of times it's a pretty good sized benefit. There's one company at this time offering $181 in healthy foods and extra over the counter items per month. So if you're a family who, say you're not able to work because you're taking care of your loved one, and, sometimes things get a little bit tight because the cost of living has gone so, crazy out of control these days, that could really help a family or someone living in their apartment alone on their income, being supplemented by family, that could really help them. So it can be very, very beneficial in certain cases. Transportation assistance can be really beneficial. If you, I have a lot of families that I've worked with over the years that if their loved one needs to be sedated, it's very hard for them to drive them home and monitor, coming out of sedation and things like that. So transportation assistance is a great resource for something, instances like that. The gym membership, the online fitness benefit that is helpful for some families, and then meals following hospitalizations maybe not be the most yummiest meal ever like the one you're cooking, but when you're coming out of hospitalization and you're just kind of feeling not yourself, having a few frozen dinners to heat up in the freezer is a nice thing to have. So those are some things that you get if you choose the Medicare Advantage direction.
So Robert is saying that he found that the Advantage plan pays very little dental. Do you know how much they cover, or is there a plan? Oh,
So dental is a little bit different in a special needs plan versus a regular Medicare Advantage plan. That's why I was saying that you can look at Medicare from lots of different viewpoints. So in my particular case, when you're looking at a Medicare Advantage that is a dual special needs plan where it combines your Medicare and Medicaid, it's dollar for dollar coverage. So you're not having to pay half of the cost, or sometimes 70% of the cost, in like in some of the traditional Medicare Advantage only plans. In these plans, there's a lot of times a pretty good dental benefit built in, where when you go to an in-network dentist, you're getting um, in some cases, I've kind of averaged it out, but around $2,500 worth of dental that you're not having to pay out of pocket for. So there are, some limitations. It's not going to cover every single service the dentist offers, similar to any dental insurance these days. They don't like to cover when you need an implant and, certain kinds of specialized services, night guards and all of that kind of stuff. But for two cleanings, exams a year, getting your x-rays done, getting your teeth cavities filled, maybe a root canal, the basic things to keep a healthy mouth, for the most part, the plans are covering that.
good.
Another
Can you?
thing that I put on the slide, and this is just a little shout out, because not everybody knows services like this are out here. Enable Dental and I have helped each other out in the past with some different marketing. And one of the things that I learned from getting to know them is that they bring dental to your door. So they're actually coming out to houses and facilities and trying to help anxious patients that don't really like to go to the dentist. And by the time they get there, you can't get any work done. Their goal is to be able to help you with dental without sedation. And they'll give it a try. So I went ahead and put their information on the slide in case that's something somebody might need. Where a mobile dentist comes to you, and they're not the only one out there, but that is their specialty, is to try to get the dental done without any sedation. So it's really cool to try that if it's something you're trying to get away from and is necessary.
That is so cool. We have actually done webinars, full webinars with Enable Dental. So if you participants want to know more about them, we already have a webinar with them on our YouTube channel. So you can go check that out and learn more about their practice. But it's really cool that they come to you.
I see something else in the comments about getting with an ombudsman to help get Medicaid reinstated.
Oh, yeah, I
There's
love that
also a
idea.
really great resource called Disability Rights Texas. And disability rights, not only will they help you get your Medicaid reinstated if they have to pick and choose how many cases they accept, but they will help you with anything. Like if you feel like you're not getting the services that you deserve as a disabled person in this state. I know there's some people
Mhm.
on here from other states, so I apologize if this isn't specific to you guys. But Disability Rights Texas is a great resource, and you can kind of Google them and find their intake line if you're having trouble with state benefits or any programs that you should be getting, full services through that you feel like are lacking. Okay, so the next slide. So since I was sharing with you guys that I have worked in the setting of a waiver program before, I like to include this information in here. So waiver services like an HCS, a Texas Home Living, class, the deaf and blind waiver, there's 5 or 6 different choices you have here in our state. And these waivers are tied to Medicaid eligibility. So if you get Medicare, that is completely separate. You are entitled to Medicare based on a parent's work record or your own work record if you're a disabled person who is able to work the, required amount of time. So you do not have to worry about losing any waiver services if by accepting one of these plans. I've also been asked before, oh, well, it includes this over-the-counter and dental benefit, the over-the-counter grocery benefit. Do I have to put that down on a SNAP application? I can't specifically tell you yes or no, but my advice would likely be that these plans you're signing up for as a Medicare plan, and that is a perk of having the plan, not a piece of your income. So I would likely think that you would not have to disclose that because it's not an income-based portion of your benefits. Now, just kind of going into a little bit further into the managed care Medicaid. I know I kind of got off of the slide order a little bit, and then I got myself confused. But what I was wanting to tell you guys about the managed care Medicaid is, the Star Plus, that's managed care Medicaid. There's also a program that they started called FIDE, fully integrated dual eligible. So kind of going to the question that was asked about, oh gosh, sometimes they bill one, they forget to bill another, that Medicare and Medicaid don't talk to each other. And it can be incredibly frustrating if you get into down that road with the billing folks that maybe don't know all of the ways to do things. One of the ways that we are trying to correct that is by putting new programs into place. So the goal is to get Medicare plans and Medicaid plans fully integrated. So that means if you get your Medicare through United Healthcare and you get your Medicaid through United Healthcare, so Medicare dual special needs through United Healthcare Star Plus Medicaid, those are the same company, so they should talk to each other. So that is one of the things that they've been working really hard on federally, is to have the plans managed where when you pull up claims, in the best case scenario, when you pull up claims and you use your United Healthcare dual plan with your United Healthcare Medicaid backing, the person you talk to can see all claims, Medicare and Medicaid related. So that would cut back on any kind of, prior authorization delays and, referral issues and things like that, because everybody can see everything that you're doing. So that's the goal. And they just started this past year, and they're working, towards further integration. So we'll just kind of see how that progresses over the years.
Hopefully it'll go well.
Yeah. I mean, it really is ideal, that one person can see all claims so that they can help you better. So just kind of talking a little bit more about, why, what I will do if you decide to work with me and you want to check the path to Medicare Advantage for your loved one. So we can't just get a call on the phone. This is happening so often, you guys, these bad agents that make us all look, like, just bad agents.
Mhm.
So there are steps you have to take before you go in the Medicare Advantage direction for your loved one or for yourself. And that is to check your eligibility first. So, some people don't keep up with the Medicaid levels and the extra plans that sometimes are available based on that level of, assistance. So be talking to somebody who knows to ask you about eligibility more than just a red, white, and blue Medicare card. Okay, so that's really important. In the top of your traditional Medicaid card, on the top corner, it usually will tell you what your level is. So the traditional Medicaid card has a Texas on it. If you're here in Texas, it has a Texas on it. And in the top right-hand corner, it's going to say QMB or SLMB or whichever one it is. And there's also letters that you'll get from Social Security that will also distinguish that. But those are, easy ways to check if you're thinking, oh, I wonder what mine is. I'm not sure. Those are ways to find it. Or you could call 211 and ask for the MEPD department. That's the specialized escalation department that knows a little bit more about people with disabilities, especially if you're in a waiver. If you ask for that department, just kind of keep talking over that little robot person and say MEPD,
Mhm.
MEPD, and they eventually will just get you where you're going. I kind of learned that trick over the years. It cuts back on all of the being passed around from one person to the next that isn't sure what's going on. Anyways, if you call them, they can tell you as well. Um, Checking the network is probably the absolute most important step in the process. So if like I said, if you get a call and they're like, we can get you a grocery card, sign me up. But they just said, oh, all your doctors are in the network. Well, how do you know my doctors are in the network? Don't just assume somebody knows what they're talking about. Question them on it. If you work with me, one of the things that I do is I take that extra step to call every doctor's office and ask them, do you accept this plan or this plan, whichever one we're looking at? Because many times the list online says one thing and the office staff says another, and they're the ones that know the true to date information. So always check the network, every single doctor, dentist, eye doctor, whoever is important to your care team. Checking medications. So this is where we're making sure that, like it's so easy to say, well, all your medicines are going to be covered because you have Medicaid or you have extra help. So don't worry. That's not always true either, because there are situations where the plan you choose through Medicare, your prescription drug plan, is not going to include every medicine that you take. So they are formulary based. So sometimes they'll tell you that you have to take an alternative. Sometimes they'll tell you that you have to try, the step therapy with different ones until you get to the one that you really want. So those are things I can help you talk through and figure out how to sort of get around and push back a little bit to try to get the meds you want covered. But the best way to go is just start out knowing that your plan takes your medicines so you don't have any surprises. And then we compare the plan options. So I try to narrow it down to two so it's not super confusing just based on interest, needs, networks, medications. Sometimes that, kind of shifts us down all the way just to one choice. Sometimes it gives us two or three options. If you live, Dallas, Fort Worth or Houston or, one of the bigger metropolitan areas, Austin, you might still have 10 choices. And that's just super overwhelming. So we just keep filtering until we're down to just one or two. And once I've answered all of your questions and you feel really comfortable and you know all the information, then we can complete an enrollment. So that is the process for enrolling in Medicare Advantage. And I highly recommend that process is done, whether you talk to me or whether you trust someone else. Just make sure that you're covering your bases.
When people call, and we were talking about saying MEPD, was that when they're calling the local social security office?
That's when you're calling 211 Texas. So that's the Medicaid hotline. So you press 2 for the Medicaid benefits, and then the robot comes on and just talk over her and just say MEPD, MEPD. And then
There you
eventually
go.
I'll send you to someone and then ask, am I in the MEPD? And they'll say, well, tell me, Mona, and then they'll eventually transfer you. But those are the folks that really understand people that have disabilities, not just straight Medicaid cases.
Hmm.
Um,
And I
so,
think you have to dial pound first, right?
oh, I can't remember.
Yeah, if it doesn't work, if you just dial 211, then hit pound 211. See if that works.
Very true. On my cell phone, you can just do 211, but there's different ways to do it on different types of phones. Yes, for
All right,
sure.
cool.
So kind of my last little slide just says that not only should someone like me, a Medicare advisor, not only should we be available to help you through the application process, the insurance companies that you enroll with pay us for our continued support to your care. So make sure that you're getting that. So anytime you sign up with me, you get me year round. I'll help you find doctors, specialists, dentists. We'll look at questions that you have. If you get a bill that you shouldn't have gotten, I'll call with you. If we need to put in a prior authorization question, we can do all the things together. So I am the queen of three-way calls to the insurance company. They won't usually talk to me without you, but they'll let me talk with you so that we make sure we're getting the answers that you deserve.
That is so wonderful. I hope everyone is writing down your number and email. But if not, you will be getting these slides later on today, and you'll have all of Lynsey's contact information. My contact information is in the slides. Thank you so much, Lynsey, for everything that you've taught us today. There's just a couple more slides. I'm not going to spend much time because we are out of time, but we've got a link for our upcoming webinars. We've got information about the team at Consolidated Planning Group. We've got information about a new service that we offer where we can help you. Just like Lynsey helps you with your insurance, with your health insurance, we can help you with an SSI or SSDI application. And this, finally, is how you schedule your free consultation with Consolidated Planning Group. We are the financial advisor side or and special needs planning side. So you can use this QR code, call or email the office, or call or email me directly, and we'll set you up for a free consultation. Right now, we're still doing 45 minutes for free. That might change in the future. So I'm going to start saying that. So as people watch our old webinars, they're getting that information. Everybody, thank you so much. If we did not get to your question, please feel free just to reach out directly to me or to Lynsey because we are out of time for today. So thank you all for being here. I hope you have a wonderful day. If there's anything you need, we are truly here to help. Thank you, everybody. Bye-bye.
Thank
Thank you so
you.
much, Lynsey.
Thank you,
Bye.
Michelle. Bye-bye.